him on raw food as of yesterday.
Yeah.
There he is. There he is. I see
Yeah.
Paula's here too.
Who is
Hey,
that?
Dr. T.
Did you?
Hi, Paula.
Hey, look who's here. How are
All
you?
kinds of fun people.
What time is it? What time is it there?
You're muted,
You're
Paula.
you're muted.
Oh, one
There
second.
you go.
It, can you hear me?
I can now.
Oh, okay. I'm not sure why it looked like it was unmuted, but anyway, yes, it's 1 a.m. But I'm still rest and active. I'm still doing stuff, so I'm just gonna be on my phone, and I'm gonna be here. And then as soon as I quiet down and I put off some lights and stuff, I'll sit down and listen properly. But I am listening, and I'm here to interact and everything. So 1 a.m., but it's fine. I'm
Oh,
happy
good
to
to
be
see
here. I missed the last two because of many things. I was so sick once, and yes, so all good now. How are you, Jonah?
I'm doing great. Thank you. It's great to see you.
Yeah.
Wonderful to see you.
Well, I'm
Yeah.
tired
And
now.
Dr.
Just thinking about it being 1 o'clock in the morning makes me sleepy.
How are you, Dr. Thomas?
I can't complain. Everybody stopped listening to me complain, so I quit. Nobody listens anymore. All right, cool. All right. Hey, Jennifer, how are you?
We're good. Bill's wandering around in the background, so if you see him walking around, he's here too.
Got your Christmas tree all decorated and everything? Wow.
Oh yeah, yeah.
Cool. Cool. So how have you been?
We've been good. You know, other than dealing with Tahoe and his ailments, but yeah, we're good. It's been a while since we've gotten to talk to you.
Yeah, it has. I'm sure happy that you joined in. So yeah, cool.
Absolutely.
Well, good. Hi, Amanda. See you.
Hello,
How are you doing?
I'm well. How are you?
Pretty good.
Thank
Yeah.
you for having this.
Well, you're welcome. And I don't know who this person is down here in the corner down here. Something like Jolly Ann. That her
Yeah,
Jolly Ann.
Hi, Jolynn.
Usually
You were
it's
educated in science, not
English.
not not literature.
it's usually a big baseball thing that says San Francisco Giants or something like that on it.
Black Lives Matter.
Like always. Okay.
That's the message, Dr.
That's
Thomas.
the new message, huh? Well,
That
that's
no,
good
that
because
is my old message.
that we've got one out in the front yard. It's a sign that just says exactly that.
That's right.
Yeah,
Yeah. If only our laws behaved like that.
yeah. You put a sign out there, then you can behave any way you want to. Because no, I'm teasing. I'm teasing. So, Jonna,
Yes.
tell me I'm wrong, but your appearance looks different. Did you do something with your hair? Did you change
Her
your hair
hair and
color?
her glasses.
Okay.
Yeah. Hair and glasses.
My
Definitely.
goodness.
Yeah. Changed it up a little bit.
I guess I'm going to have to get Lisa in here, have her take a look here. Hey, Elizabeth, how are you?
Hi, I'm doing well. How's everyone?
So far, so good. Thanks for joining.
Yeah, of
Yeah.
course.
Hi,
Yeah.
Elizabeth.
Hello.
That's Jonna up there. She's got a different appearance today. So she's a
Jonna, you do.
Just for today. Yeah.
it's Jonna 2.0.
I like it.
More like 12.0. There's been a lot of changes along the way, but yes. Yeah. Hopefully. Thank you.
Well,
Yeah,
cool.
no, looks good.
Thanks.
Well, when I thought about having one, I thought, well, it's kind of close to Christmas, and we haven't had one in a while. So I thought, well, what I'll do is we'll just have one and kind of make it a kind of a gathering of people to enjoy our time together and say Happy Christmas and Happy Holidays to everyone, and take the seriousness out of it. And so I really don't have any topics, and unless somebody's got something that's just in dire strait right now that's going to die without immediate attention, then we'll keep it light. People that raise their hands, I'd never call on them.
Oh, Paula in the front row.
What can I do for you?
Um, I was wondering if you could clarify the differences between regenerative anemia and non-regenerative anemia, and also what are the tests that tell us which one is which, and also what can we do about it, and what is more appropriate to do. I have some ideas. I have a very sick kitty at the moment, and I just got the blood test back, and it is a disaster in the UK. The system is absolutely broken. It is illegal to prescribe. Ask me how I get fluids for my cat, but but it's illegal now for them to prescribe, which is bonkers, because I'm honestly keeping her alive with fluids, with feeding, with syringe feeding, and everything else. But anyway. Yeah, so these are illegal. FMT is not available. They can, like, again, don't ask me how I get FMT here, because it's a whole, anyway. And yeah, so I have no access to medicinal cannabis, but I do have CBD if I want to use that. So at least that I can get. Anyway, so long story short, she has coccidia. We want to get rid of coccidia. I tried the natural protocol. It's not enough. I think she has a burden of parasites disease quite significant. And I think that is the cause of her low blood count. She looks pale. Her gums look pale. She hasn't been eating for a week. She doesn't want to touch water. So now that I received the results, I can see that the kidneys are struggling a little bit, but they're not like, we're not at a point, she's 10, we're not at a point where it's like advanced kidney disease where the anemia is part of then the whole picture. So I'm thinking that the coccidia is causing the anemia at this point. Obviously, the drug that is available in the US to treat actually coccidia is not possible to prescribe here, because it's apparently a human drug, and they are forced to give us a drug that doesn't work but is labeled for cats, so that they don't have to prescribe the human drug. I mean, look, anyway, so he is looking into what other drugs we can use, and I want to reinforce her immune system. I want to boost her immune system, and I'm thinking of using potentially, I think, to help her bone marrow and I'm definitely spiking her fluids with vitamin B12. But yeah, so, and I looked for more information, and it has been a bit difficult to find the basic information is easy to find, but the information beyond, these are the two types of anemia, and ask your veterinarian, and off you go into the sunset. Apart from that, I've studied myself a little bit before, so I remember all these things that I said to you, but I just would like some clarity about it, if you don't mind. And obviously, if you don't mind, I know we're close to Christmas. If you want to, obviously, have a chit chat is no problem, but yeah.
Okay. So is everybody now in the Christmas spirit?
I'm sorry.
Oh, I'm teasing. I'm giving you a hard time.
Oh.
I'm teasing. Okay, let me tell you, Paula. First of all, what I want you to do is that when you get a chance, I want you to do a post about your kitty, and I want you to put everything in it, the lab work, everything that you have, so that I can look at it, okay?
Mm-hmm.
Because
Yeah.
when we're speaking generalities, then that's all we're speaking, generalities. So when I look at your cat and I look at everything that's going on, then I put the pieces together, and then I can figure it out. Otherwise,
Yeah,
it's
absolutely. I even have the Chinese personality test that I looked at what she responds to, etc. So you will have a very full picture looking at everything there. So
yeah, let me do that. But okay, let me back up a little bit. And for the new people, and there's going to be some people I know that are going to watch this on the video too. I want to go back to the beginning of the roots of why we started this group. Okay, what did we start at, about 8 years ago or something like that? About 8 years ago. Anyway, the whole the whole intention of the group, at least my intention was forming this group, was strictly to empower the members. That's it. Okay. It's to empower you so that you can learn enough about so that you don't walk into the vet blindly, like a sheep, and so that you're prepared, so that when the lab work comes back, you can look at it, you can assess it. And so that's what it's about. It's about empowering, being proactive. That's what it's always about. Okay. Yes, I'm here to answer questions when a pet gets sick and stuff like that. And there are other people in the group that pitch in and stuff. Jolene's outstanding with coming up because she's got a lot of experience and stuff. So yes, things come up. So it's like her kitty cat, and we're going to help her with that kitty. But we never want to lose the fact that this is a learning group. It's an empowerment group. Okay. And I think Jolene and Jonna will attest to that being empowered and proactive is the way to handle health situations, and not when they get sick, say, okay, now what do I do? I want you to have the confidence in yourself that says, okay, I'm going to dig deep. And like Paula's just talking, I'm going to dig deep. I know a lot, and maybe I can get some of this stuff off the site, because there's a whole lot of stuff about lab work and everything on the site. Pick it out. In other words, it's like a school. It's like a school, so that we're empowering you, because I'm not going to be around here forever. And when I do check out, or when whatever happens, that I'd like to feel like that everyone that's been in this group is much more empowered than when they got in here. Okay. That's my goal. And it's never wavered. Okay. So keep that in mind. And, I have mantras all the time. My mantra is test and bless, bless and test, bless everything, test everything before you give it, and then bless it before you give it. You cannot go wrong with that combination. You cannot go wrong with that combination. But back to the empowerment, it's really, really, really important that you participate and learn before your pet gets sick. It's fine, but I don't want people to come into the Zoom meeting just because they get a sick pet and they want to be able to throw stuff at me. I don't have a problem with that. I love helping people out, but I want people to come in here because we're going to talk about heart disease, or we're going to talk about intestinal disease, or we're going to talk about energy treatments and stuff like this. So that it's like going to school. So you learn a bit. I learn a little bit of it. And if you've been here long enough, you'll know that a lot of times I'll cover these things 2 or 3 times. We've gone over lab work before 2 or 3 times. And so that's what I want you to do. It's like a school, teaching you more. And you guys that have been in here long enough, like you go to let's say you have a pet and it's sick, and you go to the vet, and the vet does an examination and they can't find out the problem. And then they say, okay, and we're, veterinary medicine, just like human medicine, it's all about algorithms. Okay. So the next step is they do blood work. And so the blood work comes back and they find an abnormality. Okay. I don't care. They find an abnormality. So they come into you, or they call you on the phone and say, got the lab work back, and this is what we're finding. We're finding elevated such and such. We're finding a problem here. And then, so for those of you that have been around here, what's the very first thing that we ask the vet? When they tell us when they tell us this lab work is abnormal, what is the next thing what is the thing that we should absolutely first thing in our mind and that we're going to ask the vet?
What they think the cause is?
Was there an error in the lab?
No, even before that.
What's the
This
baseline?
is so important. So don't forget this, or write it down, or whatever. Do a tattoo on your arm. Okay. Does this thing that you found, this abnormal lab work, does it explain the symptoms that are going on that I brought the pet in for? Do you understand that? Because lab work is going to tell you a whole bunch of stuff about a whole bunch of stuff. Okay. And I see that all the time where the vet says, oh, your cat's got an elevated such and such. It's got an elevated thyroid gland. So I've told this story before. We have right down a block and a half from where I live is a feline practice only. That's all they work on is cats. And I had a lady contact me one time, and this is what she did. She had a sick cat that wasn't eating and was vomiting. So she takes the cat into the feline specialty practice, and they do an examination on it, can't find anything. They do blood work, and then they get the blood work back, and they call her, and they say, your cat's got elevated thyroid, and it's hyperthyroid cat, and we need to put your cat in the hospital for 3 days and do radioisotope treatment for the thyroid thing. And she says, okay, whatever needs to be done. So she drops the cat off. They keep it in the hospital for 3 days, do this intense treatment for the thyroid, and then send it home, and under caution because it's had radiation therapy. And she goes home, and the cat's not eating and it's vomiting. Okay. The problem was the cat was hyperthyroid, but that's not what's causing the cat to not eat and to vomit. You see what I mean? So this happens every single day at veterinary hospitals because they're looking for an answer from the lab work, and they go, there it is. And they don't take the time to sit there and say, hey, does this explain what's going on with this patient's symptoms? And we cannot allow these veterinarians to make these mistakes because that's the difference between life and death many, many times. Okay. And so just keep that first and foremost when it comes to lab work. Does this explain the symptoms? And if it doesn't, then they need to keep looking because so many things that are associated with the gastrointestinal system, the blood work doesn't tell you anything. You can have a patient with the worst cancer that you've ever seen in your life in the stomach, and the blood work is going to be perfectly normal. Okay. So if you've got a cat that goes, or a dog that goes in and it's got gastric carcinoma, which is a malignancy that's, considered a terminal disease, and they run blood work and they find out that the liver's got a mild elevation of the ALT, and they sit there and say, oh, your pet's got liver disease. It's just veterinary medicine. And I hate to say this, but veterinary medicine is just like, has gotten to be like the quickie lube, where you run your car in, and they work on it real fast and they run you out the door. And I know not, and part of it's because of the corporate veterinary medicine where you have to see so many patients a day and stuff like this. And we're just not taking the time as clinicians to sit there and say, hey, have I done a thorough job with this patient? And it's just really, really sad. At our clinic, the clinic that I was owner over in Coeur d'Alene, one of the owners, we had a policy. When we got a patient with a file, that file was never put back into the system. It literally stayed on the clinician's desk until that patient was back to normal. It never went back into the file system. We called them if they went home, our receptionist would call them every day. How's Fido doing? How's Fido doing? How's Fido doing? As soon as they said he's back to normal, everything's great, we put it in the system back in, we refiled it. Never went in until the pet was normal again. And we don't do that stuff anymore in vet medicine. They're out the door and move on to the patient, and they've forgotten about it. And so the more that we move in that direction, the more that our pets need us to make sure that they're doing their jobs. There's not a day go by that I don't have somebody that I'm sitting here saying, your vet's not doing their job. Your vet's not doing their job. So and I'll tell them, that's what you paid for. That's what you paid for. Have them do their job. And anybody that walks in there that's empowered and says, hey, what do you think? What do you think about this? Or what do you think about that? And you're right. And you know what you're talking about. It's doing two things. One, putting them on alert that you're not a sheep and you're not going to go around with anything they say. And two, that they're pointing the finger and say, I want some answers. We've talked about kidney disease time and time and time again. You go to the vet and you have a sick pet, 10-year-old dog, and it's vomiting off of its food. It's been like this for a couple of days. You go in, they do an exam, everything's normal, take some blood work. You go home and they call you up and say, oh, your dog's got kidney disease. We're going to send you home some prescription diet and something for nausea, et cetera, and we'll have you come back in 3 months. You know, there's no such thing as kidney disease. It's not a diagnosis, it's a pointer. So what does it mean? It means that if the vet calls you up or calls you up, maybe your dog's in the hospital, and they say your dog's got kidney disease. So what is the next question that we say? What's causing it? All the vet's telling you is your dog's kidneys are sick. That's it. That's what kidney disease means. Your dog's or your cat's kidneys are sick. That doesn't mean anything. So we have to empower ourselves to say, okay, I understand that. So what's causing the problem? What's causing the pain? You know, it's like if you went into the doctor and you were feeling bad and you're sick and they do all this work and everything, they call you up and they tell you, you're sick. We got a diagnosis, you're sick. That doesn't mean anything. You know, what does that mean? That's what the blood work told them, that the kidneys are sick. And that's what they're telling you. Your kidneys, dogs or your cat's kidneys are sick. It means nothing. It means nothing. And the sad thing about it is that I can't even count how many patients that happened to today. Just today in the United States. They do blood work, call you up on the phone, your pet's got kidney disease, come in, get a bag of prescription KD diet. We'll see you back in 3 months. And a third of those patients, they don't make it 3 months. They go into an acute renal crisis and then in the hospital trying to die. There's no excuse for that. No excuse. So when the vet calls somebody up and they say, oh, good, I'm glad you found out the answer. So what's making my dog's kidney sick? Oh, then they go, oh my God, now I have to do my work. You know, I was okay giving you KD and telling you to come back because I had another patient waiting. But now you put me on the spot and I got to do my job. So I tell people every day, have your vet do their job. That's what they're trained to do. I'll sit there and say, every vet out there was trained to figure out what's wrong with those kidneys. There's not a vet out there that hasn't been trained to do that. So why aren't they doing it? Because they're too big of a hurry. Too big of a hurry. And when the client ask me that, well, what do? They follow the same algorithm that I do and that every vet does. We were all trained with these algorithms. Get the algorithm out. If you don't remember it in your head, get it out of the book and go to work. But don't send them out of the door without an answer. And then they die, and then you got it on your hands. But the veterinarians are like, it was an old dog. It was old. It was time to die. No. And
I've been here about almost 4 years, and I thought vets are not trained to find out why the kidneys are out of whack.
Well, you thought wrong. They are. And the problem is that because they don't, then we assume that they haven't been trained. We all follow it's not being a doctor or clinician, veterinarian, whatever. It's not rocket science. It's following algorithms. And, you know, algorithms are out there everywhere in the United States. Everybody follows algorithms. And that's what it does. And Paula's asked a question about anemia. Okay. So let's talk about that for a second. And so a cat comes in or a dog comes in and the client says, my pet's it's been really sluggish lately and just seems to be lethargic, doesn't want to eat much. And, you know, and so the vet does an examination and looks at the color, and the color's really pale. Okay. Instead of being pretty and pink, it's real pale. And they go, whoa, this patient's anemic, you know? And so that they found that on the examination. That's what they're supposed to do. And they go, okay. And because remember, they're always starting at the face and the head. And so they look at that first and, oh, we got an anemic patient here. And so then they go on. What else do I find here? Listen to the chest, feel the abdomen, everything, looking for why. What's the possibility? You know, if it's a dog, let's say it's a 10-year-old boxer, and the dog comes in with the same thing. It's been sluggish, been off its food for a couple of days. And today it just doesn't even want to get up. And they look at the mouth, and the mouth is really pale, and they go, oh, this dog is anemic. Listen to the chest sounds normal, starts palpating the abdomen. Oh, guess what? There's a volleyball-sized tumor in this dog's abdomen, and it's bleeding. So the dog's got a splenic tumor that's ruptured, and that's why it's anemic. You see what I mean? So anemia, what's causing the anemia? Boom, they find it on examination. They go, oh, got a big mass here. I'm feeling some fluid in there. Maybe do the old, go in there and do a little tap in the abdomen, pull out whole blood, they know they've got a bleeding tumor in there. So, but let's say they do the exam and they don't find anything.
Yeah.
Then they say, okay, we got to do blood work. And so we pull the blood, get the blood work. Most of the time, it would a situation like that, we'll do it in the hospital because we can get the answer back relatively quick. So we get the answer back and we go, yeah, this cat is anemic. It's got a hematocrit now instead of being 35 like it should. This cat's got a hematocrit at 21 and its red cell count is 3.89, et cetera. So, and then, so in other words, the lab work has told you, yeah, you're right. We've got an anemic patient. Okay. So I've got an anemic patient that I haven't found the answer yet. Okay. So what do? I get my algorithm out for an anemic patient. And every veterinarian that has an anemic patient does the same thing. Again, it's usually in your head, depending on how long you've been in practice. But if it's not, I remember I used to work with a vet. Every time he would get something like this, he'd run back to his office, sit down and pull the books out, and start looking through them. And that's what he was doing, looking for the algorithm. And so the algorithm says, anemic patient confirmed by lab work. And then the next thing that it says is, and this is what you asked, Paula, is it regenerative or is it non-regenerative? So that's the next step on the algorithm, is in determining what's causing the patient to be anemic. Okay. So the next, why? Because if it's regenerative, there's a list of potential causes. If it's non-regenerative, there's another list of potential causes. They don't, they're separate. You see what I mean? So once you determine regenerative or non-regenerative, you've eliminated half of your possibilities. So it's all about coming down until you finally find the right one. Okay. So Paula says, what's the difference between, and how can you tell? Okay. Just like it sounds, when you lose blood, okay, let's say that you're out and you have an accident, you're in a car wreck, and you tear your spleen. This happens all the time. Baseball players run into the center field wall and they tear their spleen and they start hemorrhaging. So you lose a whole lot of blood, okay? And then somebody gets a blood sample out of that patient that's lost a lot of blood. Well, they're going to be anemic because they lost a lot of blood. But then what does the body do when the body's lost a lot of blood? Then the blood carries oxygen. We got to have oxygen or the cells start to die. So the body says, whoa, we got to get some red cells out there as soon as possible. This patient's going to die. So what they start doing is they start sending out immature red cells. Okay, haven't had a chance. And where do these come from? They come from the bone marrow. That's what produces the cells. So in other words, if we see these immature red cells, and we call them reticulocytes, okay, reticulocytes. So if we're got an anemic patient and it's got a high reticulocyte count, then that means we've got a regenerative anemia. That means the bone marrow is regenerative. It's regenerating and trying to replace that blood. Okay, that's a regenerative anemia. Blood loss, etc. So we got a list of those things. It's a regenerative anemia. Boom, 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 boom. These are the causes. And so now we look at it in the patient's really anemic, but it has no reticulocytes, no immature cells at all. Then that means the body's not responding to it. And we categorize that as a non-regenerative anemia. Okay. And then there's a list of possibilities that can cause that. And she mentioned something about the cat is probably young enough that the kidneys aren't bad enough to be. And the reason being is that a lot of patients, dogs, cat, humans that have kidney disease will start to become anemic. Okay. And the reason that happens is so you have a cat that comes in that's anemic, and you look at the chemistry, it may be the creatinine's elevated, the BUN's elevated, et cetera, and you're going, oh, that cat's got kidney disease, and you look at your red cell count, and you see that it's non-regenerative, and you say, okay, I've got a non-regenerative anemia, and we're all trained. This is not Dr. Thomas being a super intelligent veterinarian. I'm a regular, average Joe Schmo veterinarian that just remembers what I was taught in school. Okay. So I got a non-regenerative anemia and I got a cat with kidney disease. And so when I look at things, what we call pathophysiology, and what do I know about how the body works? Well, one of the functions of the kidney, and this is what your veterinarian is supposed to be telling you in these situations. Okay. So the veterinarian sits down with you or talks to you on the phone and says, "Is this what's happening? You've got a cat that's got kidney disease, and whatever's causing the kidney disease, the kidney's got multiple functions. Okay. There's several functions, but one of the functions that the kidney has is that it produces a hormone called erythropoietin. Okay. And so if it's not, and that hormone, erythropoietin, is what stimulates the bone marrow to produce red cells. Okay. So it's a hormone, and hormones do things, tell the body to do things. And so erythropoietin goes to the bone marrow and says, we need red cells. Okay. And it's a normal cycle. So it's produces. So that's a major thing about producing the red cells. Okay. If the kidneys aren't producing erythropoietin because they're sick, then what's going to happen? It's not getting a message to produce normal red cells, so the patient's going to be anemic. Okay, so you're going to have a cat with kidney disease, and the cause of the non-regenerative anemia is the kidney disease. You've got your answers right there. Okay, then the veterinarian says, okay, why is this cat's kidney sick? That's the pertinent question. Is it infection? Is it inflammation? Is it hypertension? Is it cancer? Is it chronic fibrosis, et cetera, et cetera, et cetera? Is it autoimmune, et cetera, et cetera, et cetera? And that's what our job is to find out. And we go, oh, guess what? This cat's kidney disease, the anemic cat, the one that came in that was anemic, the anemia is in this patient is caused by kidney disease. The kidney disease is caused by hypertension, and the hypertension is caused by the cat's being hyperthyroid. You see what I mean? So you're walking backwards and you go, boom, there's my primary cause right there. So I'm going to have to treat everything along the way so this patient turns around and goes back to normal. And if I don't do that, I'm wasting your time and your money. It's just that simple. It's not rocket science. It's doing your work. And we're all trained. We take board exams. To graduate from school, internal medicine, we've got to be able to regurgitate that stuff back to them. Otherwise, we don't get out of school. Otherwise, we don't get past our state and national boards. The problem is we get out there, we have all this information, and the young veterinarians, boy, they don't have enough confidence to not do it. So they're following these algorithms by the T. But after they get a few years going, they get in a hurry, boom, 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 out the door, out the door. And just how many they come back and they say, oh, it's your old cat. It's an old cat. It's got bad kidneys because it's an old cat. No, don't ever let a veterinarian tell you that your pet's sick because it's old. That's not how it works. It's a cop-out. It's a cop-out. I don't want to do my work. Let's blame it on the old age and prepare yourself because it's going to die. What a crock. And we're paying somebody to tell me this? Come on. Crazy. Find somebody that cares, treats that. Is this what you'd be doing if it was your pet? No, it wouldn't be. Hopefully not. But anyway, so that's our job as pet people, caregivers, whatever you want to call ourselves, so that we learn enough, empower ourselves enough to let these I can't even believe, like I said, I apologize because this is not the profession that I grew up in. It's not. But so we have to compensate for that. Make them be accountable. Okay. What if they did all this work and you didn't pay them? They'd make you be accountable, wouldn't they? They wouldn't let you walk out the door without paying. So make them to be accountable. And I'm not talking about being mean. I'm not talking about having an ego fight. I'm talking about making them do their job by pointing out the fact that, hey, I know about this. I've done the research. And hold them accountable. If you're going to give me some answers, or I'm going to go down the street and get somebody that can, because my pet depends on me to do this for them. You're their ambassadors. There's nobody else. Nobody else.
I think you've empowered all of us. I mean, I think all of us have a story about the information you've given us and how we've walked into the vet's office and we're like, no, we're not going to do that diagnostic. No, we know that doesn't mean like this dog needs to go on antibiotics. Like, I don't know. I think just in the, I don't know, maybe I've been in this group for like 4 or 5 years, Jonna. I don't know. I don't remember. But like, right. And I've never felt more empowered and more frustrated with like what I encounter, but in a way, I mean, being empowered is amazing, but it's very interesting to come up against the corporate vet practice and
Yes.
and how they want to diminish our empowerment. And I'm like, no, I have a holistic vet. I'm well informed and and they're like, yeah, yeah, yeah. But research says,
That's okay. The point is, in other words, what you're doing is holding them accountable. I want you to explain why you're doing this.
yeah,
I want you to explain why you're putting this dog that's got kennel cough, which is why you're putting on antibiotics, because kennel cough doesn't respond to antibiotics. See what I mean?
oh,
The veterinarian relies on the fact that you don't know
right.
kennel cough doesn't respond to antibiotics. You see
I
what I
do.
mean? But
Yeah.
how many times have you heard me say, veterinarians, clinician practitioners, we don't want to send somebody out the door without treatment? It's a psychological thing. I've got to do something for you. Otherwise, you won't feel like you've done it. In other words, I've
Give
got
you hope.
yeah. In other words, I've got to do something that shows that I provided you a service so that I can charge you. You see what I
Right.
mean? If you come in and, oh, well, your dog's got kennel cough, and 10 days from now, it's going to be fine. Give it a little cough syrup, it's going to be fine. Then you're going, and you charge me $75 for that, But if I send you out an antibiotic and tell you to give a tablet twice a day for 10 days, boom, you're focused on that antibiotic, and then in 10 days it's gone, and you're going, well, that worked. They're relying on you to do that. You see what I mean? I call that the granny complex. And are you guys, any of you old enough to know the Beverly Hillbillies?
Yes.
Remember Granny and the Beverly Hillbillies? How she always had the potions and stuff like that? Well, the word got out that one of Granny's potions was the cure for the common cold. Okay. And so anyway, the word got out, they live in Beverly Hills. So everybody got out that this Granny knows a concoction to get rid of the common cold. So all these doctors were coming into the mansion. We want to know what it is. We want to know what it is. And she wouldn't tell them. And it's just more and more and more common cold, common cold. Finally, she gave up and said, okay. And all these doctors were waiting. She says, I give my patient a spoonful of this morning and spoonful of this in the evening. I tell them to get in a bed. In 10 days, they're going to feel better. You see what I mean? So the point was they didn't do anything. It's just like the antibiotics. You see what I mean? And that's what we do. We give you something to make you believe that that's going to take care of it, so that we justify us charging you. And we do that with so many things. And the other hand that we have, and I'm not saying that these people are unethical. That's a good word. But we use, and I'm going to say we because I'm talking about the profession, we use things to give you answers that we may not have an answer for, that at least it'll satisfy you to stop asking the question. Okay? And that's human nature for a lot of people. In other words, if I can't have why doesn't this respond? Why doesn't this respond? Why is it not working? Why does it not respond? And the veterinarian sitting there going, man, I have nothing more to offer this client. I'm out of suggestions, out of everything. Then what can I tell her or him that's going to appease her, at least right in this moment, so that I can get off the phone and go on about my business? And it happens all the time. All the time. And it's like I know I've told you this story before. When I was a senior in vet school, and we were 2 months away from graduation, and we'd already taken our boards and stuff, so we were ready to go into practice. And so the veterinarians, all the clinicians decided we're going to make the rest of this last 2 months one big clinical quiz, so that every time they saw you, they would ask you a clinical question and put you on the spot. Okay, Dr. Thomas, and they'd call you doctor. Okay, Dr. Thomas, you got a cat, and it's da da da. And so they run you through all these clinical questions. You see what I mean? And every time you see imagine all us senior students, every time you see a clinician coming, you dart into the room to try to avoid it because you didn't, what to get put on the spot. Well, I told you a story. I was in a large animal clinic and we were x-raying a bull. Big old Bremer bull was in the stocks. And we were x-raying this bull's foot. And so they'd gone into to develop the films, and I was standing by this bull and I look up and here comes this vet named Dr. Smallwood. And he's coming to me and I know he's going to ask me one of these questions. And I'm like, oh God, here he comes. And he comes up to me and he says, Dr. Thomas, imagine that we're out at this farm and we got the bull in the stock. And the farmer looks at you and says, Dr. Thomas, what muscle causes that hump on the back of that bull's back? You ever see a Brahma bull's got the big hump like that? And he says, so the farmer asks you, what muscle causes that hump right there? And I said, well, sir, that's the trapezius muscle. That's the trapezius muscle. And Dr. Smallwood says, well, no, actually, that's the rhomboideus muscle. And so anyway, I said, farmer's not going to know that. And so he looks at me and he goes, you're going to do real well in this profession. And that's the point that I'm making. The farmer, if I would have said trapezius, he's going to sit there, oh, that's cool. And then the rest of everybody that asks him, he's going to say, that's a trapezius. You know that's a trapezius muscle. And that's the point. And we can tell you just about anything that we want to tell you. And you take it with a grain of salt. You say, okay, and move on about your business. And there are a lot of people out there that use that so that you will stop asking them questions. Yeah. Have you ever called a veterinarian over and over again and they're not talking? I'll get him to call you back, or I'll get her to call you back, and that you keep calling. Most of the time, it's not because they're too busy. So maybe they are, but it's because they don't have anything else to offer you. Veterinarian's sitting over there saying, Dr. Mrs. Jones keeps calling you about her sick cat. Oh, and the veterinarian's going, I've tried everything and I don't have anything more. I don't know what to offer, and just keeps dragging out. And that's what they're doing. They're sitting there saying, I wish you'd stop calling me because I don't have anything more. Instead of getting on the phone and saying, Mrs. Jones, I'm sorry, I just don't have anything more to offer you. That goes against your ego to sit there and say, I failed you. And so I'm going to do everything I can to avoid that admission. You see, so that's why all of these are just examples of ways that veterinarians are going to, any clinician are going to just find shortcuts, find ways to get it over with and get it on down the road, get that file replaced and move on to the next one. We had a policy, again, back at our hospital. When you went in the exam room with a patient, you went in the exam room with the attitude that this is the only patient I'm going to see today. Period. You don't walk out of that room until everything that needs to be done is done for that patient. Now, even if we had to admit it into the hospital, that's okay. But there wasn't anything, we've been in here 18 minutes and I got to get out of here. I got 20 patients waiting for me. That didn't exist. So,
Dr. T, you're setting the standard too high in our minds for what we encounter outside.
That's not what we encounter. And it's
what we encounter is like us. I mean, Dr. T's up here and we're like, oh, please, sir, please, could we have like a stitch of compassion? Or I think they just shove pharmaceuticals and they shove diagnostics, and
that's why you ask questions. That's why you ask.
No, but that's what, and I was going to say, that's why, we have you, and then we can say, wait a minute, I know this, and this. I know that's not necessary, but every time you tell us about what your practice was, it's so sad because we don't have any resemblance of that in modern day practice.
And that's what I'm teaching you.
Other than you.
I'm teaching you to indirectly force them
yes
practice like that.
Yeah.
Okay, I understand that you want to send home this drug. What does that mean? What do you expect to get? What can I expect when I start giving it? What about side effects? Do I have to worry about side effects? You want them to do their job. You want to know that when they finally answer you, that they sit down and thought about all of this.
Yeah.
You know what I mean? It's not about saying, I don't believe you, or I don't think that that's right. It's about explaining yourself. I can't tell you how many people get lab work back and the secretary says, Dr. Jones doesn't have time to call you about the results of the lab work. You didn't pay them to pull blood out of it and send it to the lab. You paid them to get answers so that they can explain it to you. When can Dr. Jones call me and go over the results of this? You see what I mean?
Yes.
Instead of having the receptionist say, "Oh, the thyroid came back low. You need to put, up your thyroid." No, I want to talk to Mr. Jones, Dr. Jones. Okay, that's what I'm saying. Be polite, but be firm, and make sure that they do their job. Explain it to you. That's what I'm saying. Blood work. Does this mean? Does this explain why my pet's doing this? If it doesn't, go back to the drawing board. And you're just telling them that you just answer. In other words, if this cat's vomiting and it's a hyperthyroid thing, and hyperthyroid cats don't vomit, and I sit there and say, does this hyperthyroidism explain why my cat's vomiting? And the veterinarian says, in their mind, no. And all you've done is you pointed out and jogged their memory and sit there and said, oh, I was in a hurry and I didn't think about that. You see? And the veterinarian, you know what they should be doing? Oh, you're right. You're right. I need to look a little bit closer. That's cooperation between the two. We've got to get to the.
Oh, yeah, but they'll never, it's, they'll talk science.
Exactly.
Yeah, even if we gave them
They won't look at the bigger picture.
Let me ask you a question. If the veterinarian's here and you're down here, if you're thinking I'm here and the veterinarian's up here, and the veterinarian's thinking I'm up here and she's down there, what's the problem? Come on, guys. What's the problem here?
Ego.
It's beyond that. Beyond that. Sure, it's ego, but what is the problem? The problem
is communicating.
The problem is that the intention, the focused intention, is not the same. You see what I mean? Your focused intention when you bring a sick pet in the clinic is to get it well. If your veterinarian has the same focused intention to get your pet well, then you're both coming from the same focused intention. You're both on the same level. You're both wanting the same thing done, and you cooperate.
Mm-hmm.
You see?
To be honest, I am very lucky with this particular vet because that's exactly how, because of my training, I know all the drugs that you can use with all the behavioral issues, and with all the behavioral issues, I had to pass exams with the drugs names and everything else. And when I go to the vet and I say, well, beyond this, I also am experiencing this and that, and I think my boy needs a little bit of help on the anxiety side of things. And I said, but I'd like not to give him this particular fluoxetine, clomipramine, and et cetera, et cetera. And I said, I like buspirone, but I'm not sure if it's available. Now the ball is in your court. Can you research it? And he goes, okay, I'll see what I can do. But he booked over an hour appointment for me the other day because he also has a very open mind, and he likes to hear what I use with my cats depending on what's going on. And like when I tell him, look, at this moment she's on mushroom, she's on this, she's on that, and he really is interesting where the one that is in the same practice, but he was on vacation and I really needed to speak to someone to get an appointment. That was 2 years ago. And when I called, I only had to deal with the other one because he was on vacation, like my vet was on vacation, same practice. So I spoke with the other one, and the other one is just like, oh my God, it's the opposite. And he says, he throws 5 different options at me. for something that is also quite serious, and I'm thinking, okay, this is very unsettling. You're throwing me 5 different options. They're very different from each other. Where do we go from there? And he says, oh, let's wait and see. And I'm like, okay, hang on. If one of these options is right and it's cancer, if we stay here and wait and see, we're not waiting for something good. We're waiting and seeing something really bad in 3 or 4 months' time. So let's not wait and see. Let's do something. I'm gonna start to try and find out what's going on. And I dug, and then I spoke with the other vet, and I went on another route. But yeah, it's exactly what you're saying. Some vets are completely closed-minded. They have a clock, and all, the tools that they have are very limited. And even if I tell him, I know this, I know that, I've checked this, I've checked her gums, they're not yellow, I checked her eyes, I checked this, I checked that, I did a palpation. He knows that I am hands-on with my cats and I have trained for all these things. The other one it just looks at me like, oh my God, But this particular vet that I usually deal with, he completely respects the training that I had, and he listens and he tries to find a solution. In fact, unfortunately, to be honest, it's half of it is the problem that we have in the UK, that many things are restricted, and they're just very I don't know. It's like I'm not sure if they're scared that people misuse things, but the rules are completely. It's like killing an ant with a bazooka. It's like it's too many rules for what they're for. Anyway, so in fact, when I tell him, and I said, well, this girl is not drinking, she's not eating, she needs fluids, and he said, look, I can't prescribe you the fluid because it's illegal now, apparently in the UK. And he said, but I know you can get the fluid. I know you're trained with the fluid. I suggest that if you had the fluid, you should give her 300 milliliters a day. And I said, absolutely, that's what I will get. That's what I will give her. So he talks to me and finds the solution. But yeah, it's
Okay.
hard.
And I hear where you're coming from, Paula, and I've had a lot of clients just like you. And I appreciate people that have the experience, have the education, the knowledge and stuff to make sure that I'm not missing something. And that's really important. And you're very, very fortunate to have a veterinarian that sits there and listens to you and is open to you and hears what you say. But I'm going to tell you, in all honesty, you're every veterinarian's worst nightmare.
Oh, I know.
Okay.
I know.
99% of the veterinarians do not want you as a client. Okay.
I know.
And and I'm not saying this to take it personal because you said you know it. Because the minute you walk out the door, most veterinarians are going to sit there and say, please God, don't ever let her come back in again. Okay. And I'm not trying to say that to point down at you, because I respect your knowledge but most veterinarians do not want to deal with you. You see, your type of client.
I know.
They want the sheep.
Mm-hmm.
They want the sheep, and and that's not obviously that's not good. But remember, guys, we're more than what meets the eye, and that's a big part of my teachings or what have you. Is that now those of you that's like Jonna and Sabrina and Jolene and what have you. Let me ask you a general question, just using Paula. And like I said, I could not respect Paula any more than I do. But when you sit here listening to her talk, we need fluids. The UK is against the law to do fluids, blah, blah, blah. You see what I mean? In other words, I want to do this, but I can't do this because of this. I can't do this. You know what I mean? And do you see, just using this, do you see anything flowing in harmony here? Or doesn't it feel agitated? And it's because what we do with our intellectual minds is we're trying to solve these problems. And I, because I'm a veterinarian, I have my ideas of what's going to solve this problem. And you're an educated, schooled client that believes what she believes it's going to solve these problems. And pretty soon we've got two intellectual minds that are doing this. Okay. And you can tell because it's not flowing. It's not flowing in harmony. You see what I mean? And so you can step back and just watch and say, this is not the way it's meant to be. It's how it works down here. I call it in the swamp. Down here in the swamp. That's how it works. Works every day. It's working right now. So we're all over. But we need to be more than this. That's what we're here for. I'm not sitting here telling you, you know what I mean? I'm sitting here hoping that you will get to the point that you see the big picture and say, we're gotten off track here. We need to be on the same wavelength. You see what I mean? We need to be.
I actually have a mindset. Well, in an ideal world, you know, all of us want to learn wherever we can learn, right? If it's a 40-year practice veterinarian, whether it's a kindergartner next door, right? Learn wherever we can learn. I actually have a mindset with my veterinarians that they can learn from me, and I'll be really indirect about it. Like one of the most recent ones is over at the vet school, they wanted Trex to have rabies shot. Of course, I panicked. I go, well, do you have the thimerosal-free rabies? And the vet stumbled and he came in 10 minutes later. Said, oh, no, we know you don't need to do that. You know, there's such a little bit of mercury. But I knew by asking it, he ran to his computer, looked it up.
That's right. And that's how the veterinarians learn.
Right. So I did it through the side door to you guys need to consider providing thimerosal-free rabies.
That's right. Because if you don't tell them, they'll never do it. And some
hadn't even heard of it, didn't remember that it's an option.
Some of them don't even know.
Well, maybe he didn't know. Okay.
They don't. I had a lady one time.
But that's my example of you can learn from me. And I just do it in the sideways.
Yeah. But what I'm saying is you're not doing it to prove that you're smarter than them. You're doing it because you love your pet and you don't want to expose them to that toxicity. You see the difference in where you're coming from? I'm doing it because I love my pet and I don't want it to be harmed. And if you're a veterinarian, say, I love your pet too, and I don't want it to be harmed too. And so I'm going to listen to what you have to say, and I'm going to go find out if my rabies does have thimerosal in it. You see what I mean? Mm-hmm. And so the veterinarian comes back in and say, oh my God, I didn't even know. So when he comes back in and say, well, it just has a little bit of mercury in it. You know, that's defending themselves. You see?
Oh, yeah. Oh, yeah.
And I remember I had a client one time and I said, and I knew what hospital they went to here. And I said, she had a rabies shot and she had to get it. And I said, well, just make sure it's thimerosal free. And she called me back later on and she said that she called the clinic and asked them if they had thimerosal free rabies. And the receptionist didn't know. So she went back to the veterinarian and said, this lady's on the phone, wants to know if we have thimerosal free rabies vaccine. And she came back, and this is what she told my client. She said, yes, our rabies does have thimerosal in it, but it doesn't have any mercury in it. That's what she said. And I said, I want you to look at the word thimerosal. And the letters in the word thimerosal, M-E-R, that stands for mercury.
Oh my God.
So you cannot have thimerosal without mercury in it. And so just like I was telling you about the hump on the Brahma bull, that's what she said. She was using that old ploy. Ours, yes, it's got thimerosal, but ours doesn't have mercury in it. So how many people are going to sit back there and say, wait a minute, that's a bunch of bull? You know, they're going to say, oh, okay, well, I'll bring my pet down. You see, that's what I was telling you. Veterinarians do that. And if the veterinarian intention, focused intent, primary intention was helping your pet, do you think they'd ever give that injection with mercury in it? No. And that's the problem with veterinary medicine these days. They have forgotten their focused intention, and that's to help your pet. Okay, so you have this focused intention that you've got a sick pet, and your focused intention is, normal health and well-being, right? That's what we all want, normal health and well-being. So you go into the vet and that's your focused intention. Now, let's say you hit a home run and your veterinarian and the veterinarian that you're working with has exactly the same focused intention that you have. I want to do anything that needs to be done to get this pet normal health and well-being. So guess what? Both of you have the focused intention. What do you think that's doing to the universe? What's that doing to consciousness? You're an individualization of the big consciousness. So when your intention is like this and your veterinarian's intention like this, what do you think the universe is going to do? You think it's going to sit there and say, nah, you guys are BSing me. I'm not going to help you out there.
I don't think most vets want to have that saying, have the pet get well. It's like I'll try to help the pet within the scope of my knowledge.
But we all have a primary intention. Is my primary intention to help this pet? That's the most.
I think it's within the scope of my knowledge. And because they have only the Western medicine training, most of the ones we deal with, that's the scope of their knowledge, and they know that it can only go so far. So that's why.
Let's think higher than that. Let's think higher than.
No, I'm saying I think that most veterinarians that we have that I will help them within the scope of my knowledge. And they know, though they don't communicate it, that there is a limit to how much they can help.
Okay, I want you to think about this. So let's imagine, and I'm going to use God, just because people can relate to God. Okay, consciousness, Parabrahman, field, whatever you want to say. So let's say that you're this individualization, and you know this, you're this individualization of consciousness, God, or whatever. And so here you have these two individualization of God consciousness, and they're sitting there saying, we need your help to help this pet that we love, that we care about. And consciousness says, you betcha, I'm going to help you out there, because that's what consciousness does. That's what it's there for us, because it is us. And so we've given that intention, that focused intention. And you think the consciousness is going to sit there and say, I would be happy to help you, but you just practice conventional medicine and you need to go to somebody doing Chinese medicine. No, it's going to provide you the way to do that within your scope of your capabilities. You see what I mean? It's only when you're in the ego's in charge trying to figure out things that we start limiting ourselves by our scope. That's what you're saying. You're saying within my training or my education or what have you. That's the ego. That's the ego saying I can only heal or direct healing within this parameter. That's not God consciousness. You think God can sit there and say, oh, well, sorry, that's beyond my capabilities. And what I'm saying is the intention's there, the answers are going to come, and it's going to come in a way that you can do it. You see, the technique is just, it's almost meaningless. But it's going to provide you the tools that need to, even if it says, you know what, I don't think I can help you, but Dr. Jones down here, she does Chinese medicine and acupuncture. Maybe she can help you there. You see what I mean?
Oh yeah, when that happens. But I'm saying I make that happen.
Yeah,
I make it happen.
Yeah,
and that's how I came across you, is because I was trying to help my charity, and I kept talking about her, and someone in a veterinarian waiting room mentioned, have you heard of Dr. Thomas? Because I was a proactive one.
Yeah, but that's not a you and them. That's
I'm taking responsibility for my.
Well, yeah, I know, but what I'm saying is that everything's coming through us, and the point is, if our ego, the ego veterinarian, that's like, I'm trained, I'm the doctor, you shouldn't be asking me questions. That's just blocking that stuff. It's like these clouds they've clouded over. That's not going to let this guiding source come through and provide you the answers. The guiding source is never your intellectual mind. I had coffee with my daughter this morning. She's going through some struggles. And that's why I told her, I said, as long as you're trying to figure this stuff out with that intellect, there's too many variables out there. There's too many variables. The intellectual mind can handle about 3 or 4 variables, and that's it. 3. Some people like Einstein, maybe 4, but 3 variables. And how many variables are there out there that can make your pet sick? Much more than our intellect can handle. So we have to get to the fact and say our intellect's only going to take us so far, and it's not a guiding, it never was intended to be a guiding source. It's a practical source of figuring out something. Like I told her, I said, imagine that you had this desire, this burning desire to take a trip to Florida, and you're like, oh, I feel like I need to go to Florida for some reason. And then you call in your intellectual mind and say, okay, I want to go to Florida. So let's sit down and chart out how I'm going to do it. Or should I'm going to fly? Am I going to drive? That's what the intellectual mind's for, is to work out the specifics. The guiding source is that coming through us that says, that whisper in the mind that says, you need to go this direction. Did you forget about this? Did you think about this? That's the guiding source. I told you, I just do that all the time when I couldn't figure it out. Right before I go to bed, I'd say, I need your help. Next morning, here it come. There it was. And it was like, thank you. Get on the phone. It was no questions asked. And then use my reasoning mind to figure out how to do it, Got to never. And that's what I'm saying. That's what veterinarians are doing. They're relying on their intellectual minds to come up with these answers. And when they can't come up with the answers, then they give up and get frustrated. You see what I mean? And that's what Jolene's talking about. And the point is that if they would get out of their own way, then it would come to them, and then they could come up with a plan. And the way that happens is to have the confidence in knowing that it's always going to be provided for you. Always, 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 always. Got to be thinking from up here, not down here all the time. Okay? Does anybody think that that's crazy? I mean, does that sound too far-fetched?
I don't think it's crazy.
So, Jolene, how are you doing? She left.
No, I use my resources.
I know you do.
And I think you're talking a lot about what a veterinarian should do. And we have no control over that other than to shop around, and we find the best that we can. Short of perfect almost all the time. So that's why I have 4 veterinarians that my dogs can see. I use my resources.
So
I have our local one, I have our local Chinese medicine one, and I have the medical school.
yeah. And okay. Those of you that are here that know Jolene, do you respect anybody more than you respect Jolene and her knowledge and her abilities? Can you think of anybody?
You.
Hannah.
There's nobody that I can think of that I don't respect any more than Jolene. Why? Because she's got this drive, and she's got this heart, and she's got this desire. And what do you think the universe is responding to her? Do you think the universe is going to deny Jolene? Do you think the universe is going to sit there and say, wait a minute there, chick, you are just out of control? No, the universe is saying, you got it. We're going to provide it for you. And so you're sitting there in the waiting room, and somebody says, have you ever tried Dr. Thomas? You go, that's how it works. That's how it works. I had a lady contact me one time and said, I was in church. She lived up in one of those Prince of Wales Island over there in Eastern Canada, whatever that, Newfoundland. She lived in Newfoundland, and she was in church, and she was going through the bookstore, and what'd she find? She found my book in a church library in Newfoundland, Canada. Do you think that was a coincidence?
Wow.
That's what our brain tells us. Wow, what a coincidence. How cool is that? Guys, we got to start opening up and saying, this is a really cool universe out there. I got to tell you this, it has nothing to do with this, but I had coffee with my daughter this morning, and she was telling me that she had a dream last night. Now, I'm going to tell you this, even though it might be, but anyway, she had a dream last night. And she was having, in this dream, she was having this conflict. And then one of her old friends and relatives came to her in the dream, and in the dream, she is an adult. And this girl's name is Erin, and she is it was one of my nieces. Okay, Erin was a niece, and Erin, when she was about 13, got sick and died. Okay, and the doctors didn't know why. They couldn't find out why, but she got sick, got worse, boom, boom, and died. And nobody knew why. Nobody had any answers. And she was the most beautiful, loving girl you've ever met in your life. 13 years old, and she dies. And that was 10 years ago. So anyway, she's telling me, Erin came to me in the dream last night, and she was an adult, and she was perfect. Her health was perfect. And she came up to me, and I was upset about what was going on, and she held me. She just held me. And I felt her love, and it just gave me all the confidence in the world. And I thought, that's really cool. That's really cool. But you know something? Yesterday, when I was sitting down having coffee with Lisa, and we were looking on Facebook and stuff, guess whose picture came up on Facebook? Erin. First time that I had seen anything to do with Erin in 10 years. And here I see this picture of Erin, and then the next day my daughter says that Erin came to her in a dream. Now, is that a coincidence? You know, no, it's not a coincidence. Life is just full of miracles if we'll just be open to them. You know, it's here to help you guys. It's not here to make you suffer and make you miserable. It's here to help you. All you got to do is just be open to it. Be like the flute, just let it come through you. And so, Erin, Jolene, you know I'm your biggest fan, so I'm never gonna not agree with you 110%. Okay. Okay. Just I want you guys to be open to the fact that when we come up with no answers, no matter what you're doing, just surrender and tell the universe, I need some help. I need some help. It's called surrendering. And it'll always help you. Always, 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 always. Okay. All right.
Doctor, when I put the word out on the baby that I've been flooding the Facebook group with,
Sure.
the day I put like an SOS to my trainer group and the main trainer responded, she said, my horse trainer just asked me if I knew of any beagles available. And it was literally within like 12 hours when my message was sent, like 12 hours before this person was inquiring. And so I just learned today that she's going to drive 6 hours to meet the director, who's also driving 6 hours to get Birdie to bring her back to Maryland. I know. I'm like, John, I'm totally crying too.
Yeah. And why?
You didn't
Because
shut up about it, Sabrina.
it's
You
it's
just kept working it.
it's like you got all these people out there that are sending all this love out there that for her. And what has she done? Birdie is all she's done is she's played her role so that people could come forward with all this compassion and what have you. Without her, without people that appear or individuals that appear to be suffering, how can we ever experience compassion? You see what I mean? And so there are these souls, these beautiful souls out there, animals and people, that offer to be that victim so that you can show compassion for them. And that's what Birdie did. She came into this life so that she's going to say, hey, I'm going to present this experience to you guys so that you can find compassion and unconditional love and see how the universe works from that perspective. And then you just sit there going, oh my God, look what happened. It's a miracle. Life is supposed to be one miracle after the next, after the next. And we just have to be open and say, expect it. Oh my God, I can't wait to see what happens.
I think we can all make up a story.
Yeah. God.
I think but off the top of my head, I can come up with more, that the lesson is, Sabrina, you are a powerful being. You are not powerless. You have power within you.
Thank you. That's really
It does. But you know what? We all do. We all do.
So, and it was there for you to use.
thank you, Jolene.
Yeah.
That's what I see.
Well, I'm holding my breath. I don't know. I don't count any of my, you know,
Not over.
it's not happening until Saturday. So I'm just like holding my breath,
And what?
but praying.
Please don't do that. Don't
I know.
don't
No,
what
no,
you-
I'm
what
holding
you
my breath.
gotta
I'm
do-
breathing.
You got to do is you got to be excited. You've got to be excited because you've got an experience that says, "Hey, the universe is on your side," and instead of sitting back there saying, "Well, I won't believe you until this happens."
appreciate what you have today is what I would
That's
say.
right. Oh my God! Look, I'm joyful.
Celebrate what you have today. What
Yeah.
Birdie has today is for
I mean, you guys are gonna laugh. Like so this wonderful being that is taking her on, I wrote her an email to say like, thank you. My heart is overflowing with like gratitude, blah, blah, blah. And she hasn't responded. So I have like anxiety. And I'm like, she didn't get the message. I should have texted. And then I looked at my email and I'm like, damn it, I sent it from my other account. And so like I've been like in agony that she didn't get my message of gratitude. And I'm like, she thinks I'm some, jerk that connected her and now she's doing all the legwork and I'm like, see ya. So I don't know, like every 5 seconds, I'm like, do I text her to my husband? I'm
Yes, text her.
like, you think so?
Yes.
Hey.
You can't be grateful too much in too many ways.
That's what I think. And he's
Yeah.
like, Sabrina, don't be a crazy person. I'm sure she got your email.
Be crazy. Just be you, just be
Yeah.
you. and
As
do it.
long as you're
second
not,
that.
okay, as long as you're not suffering. You see what I mean? And what you're to me is this is causing you suffering. It's because see what your mind's doing is sitting there going, oh God,
this.
you get my text? Is she ignored me?
I used the wrong account. Just
This is
stop
all-
it. I used the wrong account and text her.
So the point is that you're going to do what you're supposed to do with or without all the stories that you're telling yourself. Okay? Because that's your karma to do what you're going to do. But when you start doing this and you start doing this Sabrina stuff, in your head and all this stress,
Yeah.
I want you to if I ever instill a mantra into your head, this is what I want you to do every time. And you obviously are aware of it because you're sitting there telling us what you're doing. When you start doing this Sabrina thing, I want you to step back and say, boy, Sabrina's really losing it right now.
I do it all the time.
And the point is, when you do that, you're separating yourself from the Sabrina, this body mind that's freaking out. And if you do that, you separate it and it starts to calm it down a bit. So
you think I shouldn't write?
no, I'm saying that you're going to do what you're intended to do. But what I'm saying is stop with the mind stuff. Should I, shouldn't I, should I, shouldn't I, shouldn't I? And that's what I'm saying about the ego mind sits there and says, I need to answer this question so I'll know what to do. And the ego mind is never going to give you that answer because there's too many things that, oh, I didn't think about that. I didn't think about that. You see? So and you've heard me say this so many, I said, stop it, get quiet. And then your source will come to you.
Well, I mean, like, so I did, all your beautiful messages. And then I've been doing that meditation over and over. And then I was like, after the meditation, I was like, I'm sending this beautiful message of gratitude to her. And I'm like, boop, 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 boop. And I emailed it. And then I like check my phone every 5 seconds. Like, did she get it? Did she get it? And my husband's like, oh, please just wait 24 hours before you send another psychopathic like reiteration of your message. And so it's been 24 hours and I'm like, should I send it again? So
okay, can we agree that gratitude is about giving? Okay, so that's my best friend. Sorry, John. I'm going to use an example. My mate that passed recently, last 3 years ago, but he he used to drive me crazy. He would talk about giving stuff to his relatives or his friends or what have you, and then he would complain about they didn't respond in a way that he thought they should have responded. You see what I mean? I
Yes.
gave my daughter such and such, and she hasn't even thanked me for that yet. You know, and so that's not giving.
Yeah, I know.
That's manipulation.
I know. I just want to know that they got it. She got it though.
No, but,
difference.
no, but.
That's right. All you got to do is
It was
Just let it
conditional.
alone.
It was
Gratitude
You guys are
Let
saying,
Let
you
it
guys
go.
are saying, let it alone.
gratitude is
go.
like, thank you so much.
Yeah.
I appreciate that. I love you for this. And
That
let it go. That's giving. That's
No
unconditional giving.
conditions.
That's right.
Even if you don't know if they got it, just
Doesn't
let it
make
go.
any difference.
Well, no.
Well, first of all,
That's
how
a
many
separate issue.
how many times are they not going to get it? Really?
I don't know.
Well,
Did you sign it, Sabrina?
the point is, if you sent it out and she didn't get it, she wasn't intended to get it. You see, that's how it works. But you sit there and say, well, maybe your phone was off or she didn't get it or blah, blah, blah. So I'll do it again. And then what is it going to do? 5, 10, 30 minutes later, the next morning, oh God, she didn't respond to that. Maybe she didn't get this one either. And you get into this vicious cycle, you know. But the reason, really, if you looked at it real closely and you said, why did I send out this gratitude? Why did I send that out? I am grateful, but I had an ulterior motive. I want you to get back with me and remind me again and again that you're going to do this so that I can get a break.
Mm.
See what I mean? I got to get some relief. That's what the ego mind has said, man,
Yeah.
I got to get some relief. So as soon as this deal's over with and she's home and she got a family that loves her and everything's going fine, then I can put it to rest. You see what I mean? That's what the ego does. It's trying to take care of you, but it's doing it the wrong way. And that's what we get into when we have a chronically ill pet. Okay. And I'll use an example. And I don't know if I've told you a story or not. I had this lovely, lovely lady that used to come into my office to get acupuncture done on her pet. And she had 2 other siblings, a brother and a sister. And she had a mother, her mother was chronically ill, was getting dementia, blah, 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 whatever. And she was in her last stages and couldn't take care of herself. They didn't have money to put her in a home. And so she came to live with this lady. Her mom came to live with her. Her siblings would not help at all. They were like, I don't want to have anything to do with it. And so she's taking care of mom, going to work, doing her stuff, taking care of mom. She got to the point that she was resentful to her siblings, and even to the point that she got resentful to her mother. Okay. And so she's doing it out of obligation now instead of love. Okay. And now it's become a burden. And what's happened is the ego has gotten involved in this and is telling her, your siblings should be helping. They're not doing their job. Your mom's put this burden on you. You see what I mean? And the ego is doing all this stuff and it's making her suffer. And what she's doing is she's deflecting the suffering onto her mom. Okay. This is what she's told me. This is what she's told me. And I'm not interpreting, I'm not theorizing. This is what she told me. And so what happens? Her mom passes. And then she is so full of guilt with how this went down. And so this thing that she had the opportunity to spend the last few months with her mom and total gratitude and appreciation for her being her mom. And you know what I mean? The same thing with our pet. And even with pets, I see all the time that that ego gets involved to the point that I love my pet, but why don't you go ahead and die so I can get some relief? You see, and that's where this love for our pet has suddenly been influenced by the ego, and the ego is sitting there saying, man, I got to get some relief, whatever it takes, you know. And that's what we have to be cognizant of. We've got to be sitting there saying, if it's a burden, then my ego's in charge and not my true self. Because that woman, what she regrets and the guilt she's living with is, I had so many months left with my mom and I felt miserable the whole time and I was a wreck and I took it out on her. And so it completely ruined that opportunity for me to show my mom unconditional love. You see, and that's what we have to remember is that when we have a sick pet and we start it is our nature to do that, because that's what the ego tries to do, is to try to figure out a way that you can get some relief. Okay. But we've got to be aware that that's what's happening. And then and remember, the ego's always based on fear. It's always based on fear. So we got to sit there and say, whoa, Sabrina's ego's in charge now. That's why there's all this suffering that's going on, this anxiety that's going on. We got to rein it back in. We've got to focus on unconditional love, and that we know that life is going to never makes mistake. It never makes mistake. You got to have faith in that and be excited about it. And then it's going to reveal itself. And then you're going to, oh my God, I was so happy that I got to partake in that. I got to be a part of that experience instead of say, oh, thank God that's over. Why? Because coming around the bend, there's going to be another one that's going to be challenging you too. Okay. All right. So I don't know if this is where we were supposed to go or not, but I guess it did. But always allow yourself to let your higher self be your guiding source. Don't ever forget that.
That's given me your messages and then that meditation like combined. I had this like gripping pain in my chest and I couldn't breathe for, I don't know, like 3 days. And then your messages and then doing that meditation, and all of a sudden I'm like, I just felt relief. I mean, I just felt like the vice was off my heart, and it was a profound feeling. So I'm trying to like ride it. And every time I feel like that it creeping back in, I do that meditation again, or I read your message and I'm like,
that's what it takes. And in time, it just diminishes. And that's what happens with every gut-wrenching experience, is defusing what you give attention to, what you give power to. And if it's fear, you're going to give power to the fear. If it's love, you're going to give power to the love. Okay.
With fear, we stop breathing.
yes.
Yeah. Panic attacks. Yeah.
So you viced yourself and you unviced yourself.
Yeah. Yep.
You did it,
100%.
and you can do it again.
Yeah. Definitely.
So what is our primary focus and intention when it comes to what is the component? It's just like baking something out there. If I'm going to bake some, and I don't bake, but I'm going to bake some biscuits. Can I bake biscuits without flour? Am I right? Can't make biscuits without flour, right? Okay. So what is our main ingredient for healing?
Love.
Love. Unconditional love. Unconditional love. Cannot have healing without unconditional love. It's like leaving the flour out trying to get biscuits. It's not going to happen. Unconditional love, what does it mean? It means no resistance. No resistance. I'm not going to resist it. It's happening because it's happening. Life doesn't make mistakes. And I choose love over fear. Boom. Pretty soon you're going to be a healer, and people are going to be calling you on the phone saying, how did you do that? How did you do that? Yeah. You agree with me, Jolene?
Oh yeah,
Yeah.
absolutely.
How about you, Jonna?
Absolutely.
I'm glad
Totally.
I'm glad your name's down there.
So you could remember who I was?
Remember,
Yeah,
totally blown me away.
Oh,
Hey, Lisa,
oh
come
my
here,
gosh.
come here and have a look at Jonna.
Yeah, my cousin didn't recognize me. It's been happening with several people.
Because you're blonde?
Yeah.
Wow.
but did you have a haircut as well?
Okay,
Yes.
this is a quiz for the day.
Very
Which one
much
of
so.
these ladies is Jonna?
You look gorgeous. I
You
love
do,
it.
you look great.
I love it.
Thank
Oh,
you.
isn't it fun to make those changes?
Yes. Very fun. Very freeing.
I remember reading about Madonna when she was young, and one of the things they said made her so successful was she would reinvent herself every once in a while, and just whatever she felt like, she would do it.
Totally.
Thank you.
I think it looks great.
Thanks,
It's
Lisa.
beautiful.
Thank
All right,
you.
we can go bye.
Bye, Lisa.
No
Bye,
longer needed.
Lisa.
Bye.
See, I reinvented myself recently to be an old man, so
That wasn't that recent.
that was all right. So you guys, everybody planning on having a nice Christmas?
Absolutely.
Yeah.
I hope so.
So Paula, you
Fran.
guys don't celebrate Christmas over where you live, do you?
Who? What?
Paula. I'm to give her a hard time. Is anybody doing anything really special for Christmas?
No. Well, we have Jennifer and Amanda, and I don't know if you guys, I didn't hear when you all came on. They're new members.
Yeah, we want to hear from our new people.
Yeah.
Yeah, you guys, yeah. Speak. I've known Jennifer a long time, so we go back a long way. So you guys get yourself acquainted with her and Amanda, and so come on, guys, tell us a little bit about yourself.
Go ahead, Amanda.
All right. Well, I reached out to Dr. Thomas a couple years ago through a kidney support group on Facebook for one of my little dogs, Peppy. And then I just sort of followed along, and then I just joined this group this time because you consulted with me a couple times for him, and then once for Tim, who's sitting on my lap. And then I joined the group recently after you retired and when Sunny got sick. So I have 11 dogs in the house. Most are ours. I'm involved with Poodle Rescue of New England. And about 10 years ago, we left Massachusetts and moved to Catskill, New York. No decent vets around. I left my great holistic vet up in New Hampshire. So I was thrilled when I found Dr. Thomas and a lot of information online. And it's been a challenge with the dogs, but knock on wood, everybody is doing well. Sunny, I have some questions, but I'll send an email to the group later, a text or a post.
Good. Well, without going into detail, is there something that I can at least get you thinking about right now?
Well, he just turned 17 and he has kidney disease, recently diagnosed, and his creatinine came down a little bit, which was good, but he is a bear to get to eat anything.
Yeah. And what was the latest creatinine?
I can't.
Was it normal or was it elevated?
No, it's still elevated.
Okay.
Yeah, it was down 2 from what it was before.
Okay.
A couple of weeks ago.
So if the creatinine's elevated, what does that tell us?
I'm new to the group.
Well, we got a lot of veterans around here that I've said this many times. If the creatinine's elevated, that means the patient, whether it's a dog, cat, or human, the creatinine does not rise above normal until the kidneys are working on 25% or less viable kidney function. So any creatinine that's elevated, 75% or more of the kidney mass is sick. So and one of the worst things that we did in veterinary medicine was we started grading kidney disease according to what the creatinine levels are. And so let's say you have a dog that's not eating and it just maybe vomits on occasion, but it's not critical. And so you, again, they get the lab work back and they call you and say, oh, your dog's got kidney disease. Their creatinine is 3.2. It should be 2.0 or below. It's 3.2. The good thing is that because it's only 3.2, your dog's got grade 2 kidney disease, and we grade it between 1 and 4. In other words, it's good news that it's only got grade 2. Let's say the creatinine was 2.6. And we say, oh, your dog's only got grade 1 kidney disease. Could be really sad. It could be grade 4. And so the client's going, well, that's good news. That's great news. That's great news. It's not that bad. And then they call me for a consultation and I say, the creatinine's elevated at all. Your dog's got 25% or less normal kidney function. And they panic. They go, what? Why did they tell me that? Because we misled you. You see what I mean? I mean, yes, it's good that it's a grade 1 or grade 2 instead of grade 4. Because if it was a grade 4 and the creatinine was 10, the dog would be in the hospital trying to die. You see, but the point is, and that's what I'm going back. You heard me earlier when I was talking about it, they go, oh, your dog's got kidney disease, the creatinine is 2.2, and the BUN is 72, and the phosphorus is mildly elevated, but the dog's still eating a bit and what have you. So we're going to put it on KD diet and have you come back in 3 months. The dog's got less than 25% viable kidney, and nobody's addressing the cause. How many of those dogs do you think are going to last 3 months if they come back for blood work? Not a lot of them. They crash in between. And what we should be doing is saying, hey, forget the grading. Your dog's creatinine, the blood work indicates that your dog's kidneys are sick and critically ill, and explain to people your dog's working with less than 25% kidney function. So we've got to be aggressive right now, you know? And what does that mean? It means, well, your dog's eating a little bit, so maybe we don't need to put it on IV fluids, you know? And so what we're going to do is we're going to have you start giving some sub-Q fluids at home and come to the hospital. We're going to show you how to do that. We're going to send your dog home on some anti-nausea medication, because when the urea nitrogen levels are high, they become toxic, they become nauseated. That's why they don't want to eat. So we're going to put it on some anti-nausea medicine. We're going to give it some appetite stimulant. So we're going to be helping your dog with the symptoms, giving it the sub-Q fluids to help the kidneys. And guess what? While you're doing that, we're going to be trying to find out what caused that kidney disease. That's our job. That's our job. And if we don't do that, we're not doing our job. Now, if your dog came in and it was sick, hadn't eaten in 2 days, and the vet does the exam and they go, "Oh, this dog's got a bad uremic breath, and it's already auto-intoxicated, it's sick." So we get the back, and the creatinine comes back at 7.5. Urea nitrogen so high you can't even read it. And then we go, "Oh, this dog's in an acute renal crisis." Boom. We got the algorithm out, says you put this dog on IV fluids for 72 hours straight. And while they're in the hospital on 72 hours perfusing, we're giving that kidneys, we're perfusing those kidneys. So what are we doing? We're increasing blood pressure, getting it to the kidney, and that's providing oxygen nutrition for the kidneys. For them, we're supporting them, we're helping those kidneys because they're sick. And then we're detoxing, we're flushing out all those toxins that are built up because the kidneys didn't do their job. So we're flushing out all the urea nitrogen that's making them sick. That's all being done with the IV fluids. And then we're giving them something for nausea. We're giving them something to pick up their appetite. So we're making them feel good while we're helping the kidneys. And then what we're doing, we're going to get a urine sample. We're going to start looking for what the cause is. Look, this dog's got an elevated urine protein. That's not normal. Okay, this dog's kidneys are losing protein. And so I'm going to do a UPC ratio. Boom, comes back 2.4. We got a diagnosis. This dog's got kidney disease because it's got an inflammatory condition called glomerulonephritis. Now we know what's causing the kidneys to be sick, and we treat specifically for it while we're supporting the kidneys. That's the ones that we turn around. That's the one that goes home and lives happily ever after. It doesn't go home and die later because we didn't do anything for it. You see what? And talk to Jolynn. She's been through this with more than one patient.
Okay.
And if they're not doing the work for you, then it's our job as pet caregivers to make sure that they're doing the work. And you take Jolynn, I tell you what, she knows as much about kidney disease as just about anybody out there. And they better be on their toes if she comes in the door with a patient. Okay.
And an energy test.
Yeah. But that's it. That's what I'm saying. And that's the same thing with your dog. So we use the lab work to tell us what the problem is, to see how high it is, what the patient's doing, and it gives us an idea of what we need to do with that patient now. You know, we're not going to send a patient home with a creatinine of 7 BUN. I don't know how much you guys follow other people's posts. One of the newer clients posted blood work yesterday. And I don't know if you saw that or not. The creatinine was so high that the machine couldn't even read it. So it didn't even give a number. It was like the creatinine was just removed. Okay. And so that happens. Sometimes the levels are so, I don't care if it's creatinine, I don't care if it's BUN, I don't care if it's alkaline phosphatase, whatever, sometimes the levels are so high that the machine can't read it. It goes beyond the capabilities. And so it comes back. It's too high, you can't read it. And so if I'm the veterinarian and I'm working with this guy's dog, and this is one of our members, dog. And so I look at this and I go, wow, this dog's got 100 or 200 BUN, all these numbers, and the creatinine is unreadable. Well, I know this dog's trying to die from kidney disease. So if I start 72 hours IV fluid on this thing and I'm monitoring creatinine, how am I going to monitor creatinine if I don't have a number? You see what I mean? It didn't even read it. So if I'm relying on my creatinine to tell me if the kidneys are healing and I don't have a number to start with, how can I tell in 72 hours other than maybe I got a number down where before I didn't have a number? You see what I mean? So let's say the machine could only read the creatinine if it went to 15.
You have the ratio. Will the ratio show?
Yeah, it helps. But we're primary veterinarians.
Is the dog eating?
Do what?
Is the dog eating?
Let's not get into that.
Because it's probably not eating. Well, yeah.
Well, it's not. No, it's not. And it won't be with kidneys like
It
that.
doesn't feel good. It feels awful.
That's right. That's right. And that's why it came to the hospital. Okay. But here, let's go back to this number. And this is what's important. And this is something that you need to learn. Okay. So that's what the veterinarian did. He gave him a copy so that he could post it for us. Okay. And the creatinine is unreadable. Okay. And that's what he tells his client. The veterinarian says the numbers are so high the machine can't read it. And so we're going to put it in the hospital and that's what he's doing. 72 hours, standard protocol, 72 hours. So then he's going to, in 72 hours, going to redo the blood work. And how is he going to compare that creatinine if he doesn't have a number? You can't. But you know what?
Don't compare. Yeah.
You know what? All they have to do is to take that serum and do a dilution factor and redo it, and it'll come up with a number. And every veterinarian knows this. So you don't have to go with not knowing a number. You sit there and say the machine can't read it because it's off the, okay, what does that mean? It means that I have to get the serum, do a dilution factor, put saline with it, and do a dilution factor and run it again, and it's going to give me a number.
I don't know. If it's way off the charts and in 3 days, it's either going to be readable now, it's going to be within range of the machine, or if it's still off the charts, well, then we've got trouble.
Yeah, but what if it was 21 and then it dropped from 21 down to 15 and a half? And you can't tell because you have no numbers. Even though it's telling you, yes, the kidneys are moving in the right direction. It's not where we want to be.
I know, but after 3 days, it's still at over 15.
Yeah, that's not good. But the
No,
point
it's
that I'm
not good.
saying is that at least you know that the kidneys responding to the treatment. Okay, let's say you got a dog that comes in and it's sick and you do a creatinine, it's 9.0. Okay, you got a number 9.0. 72 hours, you do all the work that you're supposed to. You come back in and do the blood work again, and you got everything you can for the dog. You redo the blood work. Now the creatinine is 11.5. So what has that told you? It's told you that even though you're supporting the kidneys, they're getting worse. And so what does the veterinarian say? This is not good. This patient needs new kidneys. Whatever it is that's tapped out these kidneys,
It's
they're
still failing.
respond.
They're still.
So
yeah,
what-
they're not responding to
Yeah.
blood.
And so we've got a kidneys that are no longer working. And that's what the veterinarian knows. And so what do? We call the client and say, we got bad news. The kidneys are getting worse. It's not responding, and it's not probably going to respond, at least with conventional medicine. And so they usually let the pet go. Now, what if it were you and I? Let's say that you and I are the one that's in the hospital and they do all the fluids and everything, and the creatinine's going up. What do they tell you? Sorry, your kidneys
You
are
need a
good.
transplant.
We're going to put you to sleep. No, just like you said, they're going to get you a kidney transplant. But we don't do that routinely in conventional medicine, so that's usually not an option. You see? And so that you do get to these points with kidneys that they stop working. They become non-functional, and you can't live without kidneys. And you either
What
give
happened to Joelle? She had with me a year of antibiotics and nothing responded. Infection never went away.
And how many patients, heart disease, same thing, cardiomyopathies and stuff, they don't respond to meds. So if you go in and you're diagnosed with a cardiomyopathy, what's the first thing they're going to tell you? We're going to put you on meds, but we're going to put you on the list for heart transplant. Because that's the only thing that's going to save your life. And we have cardiomyopathy in dogs, same thing. But we're not going to sit there and say we're going to do a heart transplant on your dog. We just prepare you and say, hey, get ready. We're going to try to help your dog. Or we're going to send you over down the road to the guy that does voodoo, and maybe he can help
I just checked. So his is down to 2.4, his creatinine from 2.6.
you. Move in the right direction. That's good.
But we still have the anger issues or whatever, the aggressive part of him. But talking about heart transplant, I had a dog who was, according to the cardiologist, would be ideal for a heart transplant, but they weren't doing it. But he told me about a year later, after we lost her, he said, a gentleman from Japan flew to Cornell, brought his dog to Cornell to have a heart transplant. He said it was about $25,000, and this was probably 10 years ago.
Wow.
There are exceptions. That Cal Davis is still doing kidney transplants on cats, but
For
we don't. I guess there's some dogs that have had them, but they've been doing kidney transplants at California Davis Vet School for 25 years.
Wow.
But
Those are usually on young cats that have gotten into some antifreeze or something, though, right? They're not on older cats that have got disease.
Well, first of all, most veterinarians don't recommend them going to get it. You see what I mean? In other words, that's something that veterinarians, it's an old cat. Why go get a transplant? You see what I mean? Your cat's going to die, blah, blah, blah. Its kidneys are kaput. The thing that I've seen in all the years that I've been in practice, I see one cat at Cal Davis to get a kidney transplant. Okay. And she was like, I want it done. I want it done. I want it done. And so I paved the way to get her done, to refer to her. And what did we find out? One is that she had to get a donor cat herself. So she had to go to the shelter, adopt a cat, and take that donor cat with her and her cat to donate the kidney. Okay. So she had to provide the donor, and which was, so anyway, so you had to jump through quite a few hoops. And then, as fate would have it, the stress of transferring the cat pushed it over the edge and it died during the flight.
Oh my God.
So yeah, no. So it's to me. So one thing that, you said kidney transplant, but what's the other thing that they do in between? Let's say you go in, your kidneys are kaput. They say you need a kidney transplant. We're going to put you on the list, and maybe it's going to be a month or 2 months before you get a kidney transplant. So what do they do that we don't do? Dialysis. Okay. And there's a lot of people out there that are on dialysis. We don't do that in animals. And so basically they got a machine that's doing the job for the kidneys. And so again, it gets to that point that in animal medicine, we're just not quite there. And, with all the new technology and stuff, oh my God, they're doing all this surgery with robots and everything. And it's really pretty cool. Yeah. So, Amanda, it sounds like, really, to be honest with you, a 2.4, 2.3 creatinine. Yes, that's serious, but I'm sure happy that it's 2 point something and not 5 or 6 point something. Okay.
Yeah.
I've seen a whole lot of 2s and 3s that turned around and lived happily ever after.
Well, and when I started him I got him that you recommended the Happy Wanderer, the Romania 8, and renal, standard process renal.
Great.
And the first day after taking all of that, he was this happy little self again. And so he's just tanked a little bit, but I think he'll bounce back.
So are you doing any sub-Q fluids at home?
I can't. I have everything here. I've done it for everybody else throughout the years that's needed it. He just has turned vicious. And for me to bring him into the vet to do it, they're great, but they have to wrap him in a whole blanket and get him into it. And they kind of joke like, oh, Sonny's coming today. So they're funny about it. but they can get the fluids in. So I bring him there. So he
Good.
was going for once a week, and then we went
Good.
down to every other week, and then he sort of tanked like Thanksgiving and that whole thing. But
So in an ideal world, he'd be getting it twice a week at least, 2 to 3 times a week in an ideal world. Okay. Why? Because
Yep.
remember, we got 25% or less in kidneys that are trying to do the job for 100% kidneys.
Yeah.
And so with those sub-Q fluids, we're helping those kidneys. We're helping that 25% maximize their effort. Okay. And so, yes, you got a dog that doesn't like this. Imagine there's not a cat out there in the world generally that will tolerate that. I mean, they're all, I don't like that. So you've got a dog that's acting more like a cat,
Yep.
So the point is that it's like, don't we wish we could sit there and say, stop it, this is for your own good, but we can't. So what do? We sit there and say, okay, what can we do to take the edge off of him so maybe we can get this done? And so what do? We give him a little rescue remedy. We put a little bit of diluted lavender on top of their head, and we wait for 20 minutes or something, and then we do it. And I used to do that on all my acupuncture patients. There's not a patient except an old Labrador or something like that comes in wagging their tail like, I'm happy I'm here. Most of them come in there like, what are you going to do to me? What are you going to do to me? And all the cats come in and say, if you get too close, I'm going to bite the heck out of you. So again, what do? I go in and have my clients give them rescue remedy before they come. Give it 20 minutes before you come, squirt it right directly in the mouth. And then when they come, we sit down there and I rub some of my diluted lavender over the top of the head, because it's going to, not only lavender is going to be calming, it's very calming, but it's going to activate 2 points on top of acupuncture points on top of the head that are calming. So here I got this dog that's looking at me out of the side of their eyes like this. What are you going to do? And I've got to put 17 needles in this dog, and I'm sitting here going, okay, this dog's not going to let me put 17 unless I do something. Okay. So I give them the rescue ribbon. I do that. And here's this dog looking at me like this. And I talk to them and I pet their head. And then what I do, I go sit down and I start talking to the client. And we start talking, how things going, blah, blah, blah. But she's sitting by her dog on the acupuncture table. And how are you doing? Blah, blah, blah. What's going on? Whatever. We sitting there talking. And then 10 minutes later, you look over the dog and the dog's going like this. Can't keep his eyes open. He's like this. And then you go over and you sit down and you start, guess what? First needle I put in is right on top of the head. And then you have trouble holding them up because they're trying to go to sleep. You see, that's what we do.
Yeah.
No, they're not gonna be happy with this. And
That happy lab was mine, Dr. Thomas.
yeah, I know. And that's right. The happy labs. They're like, do whatever you want to as long as you love me,
Yeah.
But what I'm saying in those scenarios, and that's what you say. The vet's sitting there going, oh, he's coming in, be get ready, he's always got to. And then and if it is a dog that's trying to bite, what do? We put a muzzle on it, right? Why do we put a muzzle on it? We put a muzzle on it, and the clients say, well, they don't want to get bit, so they're going to put a muzzle on it. Well, that's true. Nobody wants to get bit by a dog. But the main reason we put a muzzle on them, what do you think the dog's doing when you put a muzzle on? The dog is totally focused on the muzzle. What is this on my face? What is this? They're 100% focused on what's this muzzle. So we were doing a psych job on them. You see what I mean? They're so focused on the muzzle that you can sit there working on them. And they're like, what the hell is this on my face? And so that's the whole purpose of a muzzle, is to divert their attention. Anybody ever work on horses? Anybody have a horse? Okay. If you're a veterinarian and you work on horses, you learn. Let's say I got to give a horse this injection. Okay. It's going to go in the neck. It's going to go in the muscle. And it's 12 cc's, big injection because it's a horse. So I got 2 options. I can go up and stick this needle in this horse and give it the injection, and it's going to jump and it's going to try to bite me and it's going to try to kick me and it's going to try to run off. Okay. That's what they're all going to do, unless it's the Labrador horse that sits there and goes, if you love me, you can do anything. Those are rare. Okay. That horse is going to sit there and say, you're not going to do that, and I'm not going to let you. And then it's going to tense up, and sometimes they break the needle and stuff like this. And you're going, oh my God, I got a broken needle. Now I've got to go in there surgically remove it. And guess what else? But instead of doing that, what do? I have the owner of the horse tap it on the front of its head like this, just like this with their fist. Tap it like that. Just start tapping. And they're so focused on that tapping their head. You give the injection and they don't even feel it. You see what I mean? So we all know that. We're all trained to do that. So we do the things to avoid that stuff from happening. That's the same thing with your dog. Give it the rescue remedy, do that. And if I have to, if the dog's trying to bite, put a muzzle on it, give it a couple of minutes, let it chill. But we're going to do the job because it has to be done. I can't tell you how many people say, my dog, when I was doing consultation work, well, I took my dog to the vet and the dog just couldn't tolerate the needle. So she told me not to, that the dog, it's not going to work on my dog, so not to come back. It's like, what? What? If I had that attitude, I wouldn't have any patience, because there's not except for the lab, there's not one of them out there that want to be done, all of them wants to leave me the heck alone.
I'll try it here because I have fluids here. I'd much rather give it to him here than have to take him in every day or, 3 days a week.
Yeah, twice a week.
Yeah.
And it's the problem again, I remember when we would give fluids to a small dog like that, what we charge $25. Nowadays they charge $150 to do.
Yeah, it's not $25 anymore.
No, but it's sad that we price ourselves out of really helping this patient. It doesn't cost a lot of money for a technician to go in there and give fluids to a dog. Vet's not even involved in it. You see,
Right.
Vet's out there making money working on another patient. So why should we be gigging you for $150 for a tech that we're paying $21 an hour and she spends 20 minutes of her time giving fluids to your dog? So I paid her $16 to give your pet fluids, and the fluids maybe cost me another $2. So I'm in it for $18 and I'm going to charge you $150.
Yep.
Not fair. It's just not fair. And so if that's not in your budget, then like I said, give it some rescue remedy. Do the dilute on top of there. Give it, wait for 15 minutes or something, and then wrap that. You have a muzzle? Put a muzzle on him. Wrap him up in a little towel and give him his fluid and tell him what a good dog he is. And there's always the frozen peanut butter in the cup if you got a dog that loves their food. And that's what I used to do. At my clinic, I'd keep cups, plastic cups that had almond butter or peanut butter in it like this, that's frozen. And my tech would sit there and the dog would be licking it. I'm sitting there putting needles in it. And the dog's just trying to get that peanut butter out of the cup. Anything that we can do to get their attention.
Yeah.
With what we're doing. Yeah. And,
Well, thank you.
and if you really want some help, you turn your head up and say, I need some help here.
Oh, yeah.
I love my dog, not because he's a pain in the ass and he's going to try to bite me. I love this guy and I want to help him because I love him. Yeah. And then the universe says, well, guess what we're going to do? We're going to help you out today.
Well, good. Thank you.
Yeah. Yeah. Come on. I wish I was close enough to help you out. I'd be happy to.
I would drive there right now if
Do
I
the
could.
do the rescue remedy and the diluted lavender. I promise you it'll help you out.
I'll try it. Yeah.
And that Xiao wand that you're talking about, the happy wanderer, that's the key to those those dogs that need an attitude adjustment. The ones that are like it, I'm not getting my way. That's what it's all about. It's all about balancing. That's a liver disorder. That's a liver imbalance. It's causing that and getting that liver back into balance there.
Okay.
Chill out. Yeah. Takes a while to get working. Let me show you. Can you see that herb? Called Shayawan. That's Happy Wanderer.
Oh, okay. That's different than the other one I have, but
The
same
Sha- yeah,
thing.
it's a different company. This is a human product.
Oh, okay.
Yeah. And why do I have it? Because I take it myself. Yeah. So it's a great herb.
Okay.
And you could ask John, if I don't take my Shayawan, I get real cranky.
Oh, yeah.
Anyway, so what else? How about you?
I'm gonna have to take off, you guys. I gotta go make dinner and feed cats and stuff.
Okay.
But thank you. This has been wonderful.
Yeah.
Very educational.
Oh, Jana, no.
Gotta go. I want to stay. But I'll see you guys all on the page.
See you on the page.
Okay.
You So
Well,
you
you
guys
know
want
what?
to go tuck you
I
in?
know,
and
I'm like
just
I'm
keep
like a
annoyed?
burrito. I'm cold and I'm so tired.
We've been going for 2 hours and I only wanted to go for an hour. So I think
Yeah.
unless we got something that we need to do, I think we need to call it a day. Everybody okay with calling it a day?
Yes.
Jennifer?
I just had one quick question for you, but it's a quick. I think it's a quick question.
Okay.
I have my lab Tahoe lab mix, and we've been giving him the Happy Wanderer and then the other one that you just showed. He's pooping like every other day right now, and you said you thought that was the reason he was vomiting. So I noticed today when I took him out for a walk with the other dog, she started pooping, so then he actually competed with her to try to poop next to her, and which I was like, fantastic, we're pooping. But he's having, I think it's his legs. His legs were really fragile and shaking, like where you remember years ago he had injured he tore his what I can't remember what that was called.
The cruciate ligament.
Yes.
Yeah.
So I think the arthritis is kind of preventing him from wanting to poop regularly.
That could be a factor. And let me tell you how to know that. Okay. This is a good learning tool. And it's usually in big dogs, like you're talking about. And so this is how you can confirm it. Okay. Because what they do, think about it, for them to poop, they have to do hyperflexion of their back. They have to squat down. They flex their muscle, they flex their hips, they flex their knees. Okay. So they've got to get in that position and hold it to have a bowel movement. All right. And so if they get in that position and it hurts to stay in that position, then they sit there and they're going, come on, and they can't stand it and they get up. So what they'll do is they'll get in the position and they'll start to poop and they'll stand up and they'll walk a bit and then they'll get back down again and they'll get up and they'll walk a bit. That's what they're doing. They're trying to have a bowel movement, but it hurts too much. And so
that's exactly what he did today. It came out in 4 pieces.
That's right. And you're dead exactly right, 100%.
Okay.
It's pain that's causing that. It's pain. All right. So now you focus on the pain. Get that pain going, relieve that pain, and he's going to start having his bowel movements regularly. But that's a common problem, and I'm glad you brought that up, because if we're sitting there saying, oh, he's got constipation, and the reason he's constipated is because maybe his kidneys or maybe blah, 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 he's not getting enough roughness in his diet, and it's all about pain, then we're going to just be doing a whole bunch of stuff and not addressing the primary problem. But you just sit there and explain it perfectly. So now we know. And so then what do? We give him something for pain. And you see when the pain's gone, he's going to start pooping normally.
So besides his acupuncture or his acupressure points that we hit for the legs, we've been hitting those forever.
Okay.
And he's still on his Chinese herb for his hips and his legs.
Which one?
Can you grab the one out of the drawer, or out of the drawer, Bill? He'll get it for in a second. And then we give him MSM, and then trying to think, and the T relief pain that we still give him that one, the arthritic T relief.
Okay.
The Chinese herb is the
Xiao Chai Hutan.
Yeah, Benefit Hips and Knees formula from Con Essentials.
Yeah, that should be helping. But the only thing that doesn't cover, that is just what it does. What that does is a Chinese herbal formula. Pain is always about the energy not moving through the area. Okay. The Chinese call it stuck qi. When the qi is stuck, then there's pain. Okay. And so that herbal formula you're doing is moving qi energy through the gallbladder meridian. Gallbladder meridian goes over the hips and over the knees. And so if you've got stuck qi in the hips and the knees, then it's going to move energy, and that's going to relieve the pain. Okay. Now, so if you're giving something that is relieving the pain in the hips and the knees, but he's still having pain, where else could be involved? The back. Because what does he do when he goes to have a bowel movement? He has to flex that back.
Yeah.
And that herbal formula is not going to address the back. Okay. So you see what I mean? So we're sitting there going, we've using this and it's not helping that much, is telling us that we've still got pain someplace else. And because it hurts him when he gets in that position, the only other thing it could be is the back. So we've got to be addressing the back as well. Okay. Now, the T relief for arthritis, that's for arthritis generally speaking and stuff. But if we can target the back, then then that's going to give us a better opportunity instead of just something general for pain and inflammation. It's like Jingtong. There's a lot of dogs that have cervical pain, and the Jingtong herbal makes a really, really good herbal formula that targets the cervical spine, and really, really good. So why don't you shoot me something tomorrow to remind me about the back pain, and I'll try to figure out what I think that we can do to help with that back. Okay.
Okay.
You
Yeah.
ever give him any massage?
I mean, just Bill gives him the acupressure every night and kind of just holds the points, but I don't know. I mean, I kind of spend more time massaging him probably than he does. He focuses on the pressure.
Just massaging that back area, the lumbar area is going to relieve. Just have because what happens is when we get arthritis in the spine, then what happens is we get muscles contracted. And so you get a combination of the arthritic pain plus the muscle spasms from that pain. And then you have a combination of both arthritic pain and muscle spasms, and that's what a lot of people get when they have. And the other thing too is just like we do, if it's in L3 at L3, L4, then they're going to get sciatic pain as well. So they're going to get pain all the way down the leg. And so again, but the source is up there. So what can we do that's going to target that and move that energy through that area so we relieve the pain associated with that low back? Okay. That's where it's got to be coming from. It's got to be.
Yeah. I mean, he was holding it down, doing well, and just, every now and then. But when I saw he wasn't, when we finally paid attention to how often and when he's pooping, I think that was helpful. So thank you.
You bet. So the other thing too, when I have a client that's telling me about that, then the other thing I tell them to do, what is he doing with his tail at the time? So dog goes to have bowel movement. What are they going to do? They're going to get in that position. They're going to lift the tail up in the air to get the tail out of the way.
Mm-hmm.
Okay. So if that's what I'm always asking, when I have an older dog that's having difficulty like that, then I said, what's the tail doing? Oh, his tail's down. You see, someone will say his tail's down. He doesn't get it out, or he gets it up a little bit, but he doesn't get it up like he's supposed to. Yeah. And sometimes if the tail's down, then we have a combination of pain and dysfunction as well. And so that we have to address the dysfunction. But if the tail's up, he's lifting it up, then that tells you neurologically he's sound. It's just pain itself.
Okay, so I'll watch for that.
On the tail as well. Yeah. But like I said, shoot me something to remind me, and I'll come up with a plan for you to address that back. Okay.
Thank you.
You're welcome.
Yeah, just so you know, when I met Dr. Thomas, it was probably almost 10 years ago that he saw my dog at age almost 3. And so he was, I don't know if you remember why how we found you in speaking about the universe. I wouldn't shut up because his anal glands kept getting impacted. And every store I went into, I was talking to people about grain-free this and grain-free, trying to figure it out. And the little store on the hill, on South Hill, the little pet store there was like, you should just try calling this guy. And like, literally we were maybe a mile away from your house, like where we lived. So that's, the universe, me not shutting up about my dog and his grain-free anal impacted glands got me over to you. So I think that, we have ever since then been like that with him, following that life for him. And then also for ourselves. Like I just went and saw a functional doctor myself this year. So it's made the world of difference in his health. I very rarely probably count the number of times on my hands in the last 10 years I've had to take him into the vet.
No, good for
you. Yeah,
it's
you made believers out of us.
the little pet shop that you're talking about.
Yeah.
The lady that owns it, her name's Deborah. She used to bring she had a Doxy with IV disc disease, and I used to acupuncture her dog. I saw her yesterday when I was out hiking.
Oh, nice.
First time I'd seen her forever. Yeah. And she sold it a couple of years ago. Yeah.
And it was not a place I frequented yet. Like, it wasn't, it was just, I happened to go in there, happened to be running my mouth about it. And then next thing I know, there we are on the journey. And I don't know if we followed up, but we rehabbed Tahoe's knee naturally. We never did surgery on him.
Yeah.
So, and yeah. So,
and I'm not saying that I do it, but I'm saying that that's what Chinese medicine can do, is avoid a lot of these surgeries, because that these surgeons are following, these veterinarians are following the algorithm. It gets down to the point, oh, you got to do surgery, you know, and they don't realize there's other options. I've got a Christmas card for one of my closest friends that lives over in Montana, and he was putting in there that he's going to have hip replacement surgery. And I'm sitting there going, should I tell him that he could go get acupuncture, and chances are they'll cancel that surgery. And I'm because I've had dogs before with hip dysplasia that they were scheduled to get a hip transplant, and they started getting acupuncture and they never ended up doing the surgery.
Yeah.
So yeah.
Yeah, she was gonna the people we were taking him to for his underwater treadmill therapy, they were going to use him as a case study in a conference to show a naturally rehab dog versus a surgical healing process because he had done so well. So I was like, oh,
that's great. That's great.
He's a little superstar.
When people see that, they go, oh my God. And then all those barriers start to come down. And that's what it's all about. Just spreading the word. And I'll tell you a really cool story. This would happen years ago when I was living over in Coeur d'Alene and practicing there. I used to help some people out that were some breeders there. They had a breeder organization, and I used to help them out. And she called me up one day and said, we're having our annual conference, and all the breeders are going to be there, and we're going to talk about breeding problems, you know, dogs that are infertile and stuff like that. So we'd like you to come and give a talk about an alternative perspective for treating these breeding problems. I said, sure, I'll be happy to. This is many years ago. And so anyway, but what else they did was they invited the doctor from the vet school at Washington State that was in charge of the same thing, fertility problems, et cetera, endocrinology, okay? So he was the big guy that dealt with those problems. So he was going to give a talk about how you do it, how you treat these patients from a conventional medicine perspective, okay? And then I was going to give a talk about how to treat them with alternative modalities, you know? And so anyway, it was really cool. We probably had about 50 or 60 people in this conference room, and he gave his talk first. And then I got up and started talking about the way we dealt with it from Chinese medicine perspective. And it was, well, you know, and I listened to him and he listened to me, and then it was over. And this guy was from India, but he was really well known at the school, really well respected. And he came over to me and he said, I'm just amazed at what you said. He said, does this really work? And I said, yeah, sure it does. And he said, he was like blown away. And so anyway, he went back to the school to, doing his job. And he went to the Qi Institute and learned Chinese medicine because he was like, wow, I got to do this. And within a couple of years, right now, he is no longer at the school. He is the head of the International Veterinary Acupuncture Society worldwide. Wow. And it all happened because he happened to come to that one talk. And that's how it works. It's just the right place, the right time, planting the seed, And this guy has done so much for international acupuncture for veterinarians, probably more than anybody in the world right now. It's really cool.
That's incredible.
Yeah. Well, Sabrina, I think, has fallen asleep, so we better go.
Yeah. It's almost bedtime here.
Yeah.
If you're on the East Coast, Amanda, it's past bedtime.
And Paula, I think she went to sleep a long time ago.
I'm awake. I was looking sleepy, so I had to turn off.
Know. Paula, you're still there. Bless your heart. She's got the lights off. Okay,
Yeah,
guys,
it's
I'm gonna
like
let
3
you go.
a.m. Yeah.
I am still here. I had to put the lights off because I don't want to upset my husband if he gets up in the middle of the night.
You send me all the information tomorrow about your kitty, okay?
I will. I'll put everything in a drive and you can have a go and look around.
I will. All right. Thank you.
Thank
Namaste,
you. I
everyone.
appreciate it.
Everybody,
All right.
Thank you very much.
Thank you.
Nice to meet you all.
nice to meet you
It was
guys.
lovely. Thank you.
Take care.